PID. What is PID? PID is even more popular than most doctors in Nigeria today because one of the most commonly wrongly diagnosed and treated medical conditions in the country. A lot of women come to the clinic lamenting that they've been diagnosed with PID through certain scans. They even go as far as going home to accuse their partners of maritime infidelity because ultrasound scan found some fluid collected in the lower part of their tummy, and they just come to the conclusion that they have PID. This is wrong. PID is not diagnosed mainly through ultrasound scan. PID simply means pelvic inflammatory disease. It is a sexually transmitted disease that usually arises as a result of spread of bacterial organisms from the lower genital tract of the woman to the inner genital tract. It is a sexually transmitted disease that is usually caused by multiple bacterial agents. It is common in young women who have multiple sexual partners, who have had sexually transmitted disease in the past, who are married to partners who also have multiple sexual partners, those we regard to as indirect multiple sexual partners. Now, these are people that regularly come down with PID, and PID diagnosis is mainly clinical, meaning we usually diagnose it by the symptoms, your complaint you bring to the doctor, and by the signs, what we see when we examine you. Then some laboratory tests are also supportive to help us in arriving at a conclusive diagnosis. How do we come to the diagnosis of PID? When a woman presents to us in the clinic, first thing we are going to ask the symptoms the woman presents with. Commonly, the woman may have foul-smelling vaginal discharge. The woman may even be running high temperature, fever, and the woman may be complaining of lower abdominal pain in the whole lower abdomen or some part of the lower abdomen. And some women may have pain during intercourse or anything that affects their lower abdomen. Maybe when they are doing strenuous exercise, the pain may be aggravated. And some women have pain immediately after menstruation that can last for less than 7 days. Any pain lasting more than 7 days after menses is not usually due to PID. Now, these are common symptoms that the woman will present with can make us to suspect that maybe the woman may have pelvic inflammatory disease. Tests that may be supported that may help us in diagnosing include not high vaginal swab, but endocervical swab. That is a swab that is taken from the inside the cervix of the woman. Then we can also do some other tests. Ultrasound scan may be done, but the finding on scan is just suggestive. It's not diagnostic. And this is where the issue is in our country. There are a lot of poorly trained people doing ultrasound scan that once they see fluid collected in the lower part of the tummy of the woman, they come to the conclusion that it is PID. It is not correct. In women that do not have PID, some fluid can collect normally in the lower part of their tummy without them having any infections. What diagnoses PID definitively is what we call laparoscopy, a type of test whereby we put some lens inside the tummy of the woman and assess the fallopian tube, the lower abdomen of the woman, to see is there pus, are there signs, there's any ongoing infection there. So it is important that women stop concluding they have PID from all these poorly done scan. They stop causing unnecessary marital disharmony by accusing their partner. They need to go to the hospital to be properly tested. And when it has been highly suspected or confirmed that you have PID, it is important it is properly treated with proper antibiotics for the long and appropriate duration of time. Because improperly treated PID is risky. It increases the risk of infertility by causing fallopian tube damage. It can cause pus to be collected in the fallopian tube. Water can also be collected, what we call hydrosalpinx, and pus can collect in the lower part of the tummy. It can even get as bad to affect the liver. And this have dire consequences on the general health and fertility of the woman. So before you conclude you have PID, see a well-trained doctor, or if there's a gynecologist nearby, see the gynecologist, ensure you are properly treated. And don't just conclude you have PID by a scan report and stop accusing your partner. And this way, everybody will be happy. You'll be happy, your husband will be happy, your doctor will be happy, and everybody will be fine. Thank you.